Good morning, everyone, and thank you so much for joining us for today's webinar on the changing face of healthcare. It is my pleasure to introduce today's speaker, Peter Shen. Peter attended Johns Hopkins University from 1995 through 1999 and holds Bachelor of Science degrees in Biomedical Engineering and Mathematical Sciences. After graduation, Peter joins the international conglomerate Siemens AG in 1999 as part of their U.S. healthcare sector. In his successful 18-year career at Siemens, he has held a number of sales and marketing management positions and is currently the Director of Sales and Consulting for Siemens Healthcare Digital Ecosystem Platform, specializing in clinical and operational services for the evolving digital healthcare environment. Peter is an industry expert in the growing healthcare imaging IT field, sitting on national healthcare standardization committees and speaking with leading technology partners such as Apple, Microsoft, and Citrix. He currently resides in Silicon Valley. With that, I'll let Peter take it away. Thanks so much.
All right, super. Thank you so much for the introduction, Kim, and good morning, everyone. So appreciate the time and your attendance this morning, and wanted to just talk to you about the changing face of healthcare. So as Kim mentioned, I've been in the healthcare industry after graduating from Hopkins here my entire career. And as we all know, things are changing quite a bit within healthcare. And I wanted to take the time today to kind of just give you some insight in terms of what we're seeing going on within the healthcare industry, how it's some of these different trends and some of these different changes are affecting not only providers or hospitals and folks that provide healthcare, but also are affecting us as patients and consumers of healthcare as well. And maybe give you some insight into potential opportunities that are there for you as an individual to participate within the healthcare industry here. So again, just some general insight that you might find helpful here through our webcast, and afterwards I think we'll have an opportunity to ask some questions as well. So. As Kim mentioned, I'm part of Siemens, and in particular our healthcare sector. We actually call it the Siemens Health and Years as our healthcare sector. If you're not familiar with Siemens, Siemens is a large global conglomerate of different industries and whatnot. We're particularly known for our engineering innovation. But within healthcare, we actually have a very significant presence as well. So within the healthcare world, we have over 46,000 employees. And as you can see from some of the different stats that are up there, we're pretty much involved in a lot of all of the different routine health examinations that are going on throughout the world. So anytime that you're having an X-ray or something done with an MR scanner or something like that, it might be a Siemens device, something like an ultrasound. If you're getting a lab test or whatnot, it's being processed on Siemens equipment as well. So our main focus here within Siemens Health and Years is really into imaging, laboratory, and point of care services for patients as well. But we have quite a significant presence, and with that, we also have a lot of insight in terms of what's going on within healthcare and the changing healthcare industry as a whole. So as I mentioned, there's a lot that's going on here with healthcare, and it's more than just kind of what we hear in the news as it relates to the Affordable Care Act and people are trying to want to change that law and change this and that. It really is more focused on a lot of different trends that we're seeing in healthcare that you see on the left there. Things where the demographics are changing, where the population is changing, where there's a lot of scientific progress going on, changes in terms of how we're dealing with chronic diseases, and then and a big shift in terms of how we actually practice medicine into more value-based reimbursement and cost pressures. A lot of those trends and everything are actually then driving a lot of transformation within healthcare that we'll talk about here today, in terms of things where we're seeing a lot of consolidation of healthcare providers to try to work together to try to tackle some of these different trends. we're seeing a trend also, a transformation in terms of industrialization. So trying to do more with less, trying to be more efficient, both operationally and clinically. And then finally, a transformation towards managing healthcare. So really trying to get a good handle on all the costs and minimizing those costs, while then providing some value to the patient and to the consumer within healthcare. So a lot of different trends here that we'll talk about initially, and then how those trends are now creating these different transformations that we're seeing within healthcare. So some of the trends that we're seeing out there, for example, is this demographic shift. As folks become older, they're actually living longer. So as you can see there, the average life expectancy now is kind of targeted to be much higher, especially not only in developing countries but also in emerging countries as well. So you know, it increased by 1 year by 2020, increased up to 76 years later this century as well. And what that means is that that increasing age in population is actually creating a larger number of patients that healthcare providers have to deal with, and that puts an additional strain on medical resources and the way that the health systems actually have to deal with this now growing population that's out there. So beyond that demographic shift, again, is this population growth. So if we've got more folks that are requiring healthcare, it's interesting to kind of look at where that population growth is coming from. It's actually, as the world's population kind of increases, it's actually not coming from industrialized countries like us here in the US, but it really is coming from a lot of emerging and developing countries. So countries that are now kind of really developing on their own here. And what that means is that it means that what we need to provide from a healthcare standpoint is not necessarily large complex infrastructure like we have here within the US, but for it to satisfy these different emerging and developing countries is really looking for some sort of affordable entry-level healthcare solution to support these different these emerging economies and these emergent countries that we have. So it's again a different kind of trend that we're seeing here to deal with the population growth. Another interesting trend is consumerism, one that I think all of us are very much used to. So as you can see here, a lot of us today, we're using technology, and we're very comfortable with using that technology. Interesting, statistics aside from the ones that you see on the screen here, 5% of all the searches that are done, for instance, on Google are all healthcare related or health related, which if you think about the millions and billions of searches that are being done within the Google platform, it's amazing that 5% of them are all actually related to health. So again, the first thing that you do if you feel pain or something like that is that you don't call your doctor, you actually go online and try to find some information out there. And we're seeing a large trend with more and more folks that are very comfortable using technology and to get that information. And not only are they using that technology to find out what's going on, but they're actually using it from a consumerism standpoint to figure out who can provide them the best healthcare. So just as much as you use other apps to figure out where's the best restaurant to go to or whatever, a lot of folks are now using technology to find out who's the best doctor I should go to. And what we're seeing here is that folks are willing to make a expenditure, or willing to pay to get the best health care provider that they can see. So if you're willing to kind of pay for the best healthcare, we're seeing a lot of folks who are doing things like, for instance, on a global level, traveling to other physicians or other locations that could potentially provide them that better healthcare. So again, general trend here that we're seeing from a consumerism standpoint, that folks are really seeking healthcare services. They're becoming more and more informed in terms of what their healthcare needs are, and that they're really looking and picking and choosing where they want to get their healthcare. Additionally, with all this kind of this burden of individuals and consumerism and whatnot, there's also a larger trend in terms of from the provider standpoint, where there's really just not enough staff that's around that can provide healthcare services. So as you can see, there's only kind of less than 2 doctors available for every 1,000 people that are out there. And then as you can see, there's potentially as many as 13 million in the healthcare individuals that we're going to be short of by 2035. And they're in all different areas, whether they're being physicians or staff, support staff for the healthcare institution. There's just not enough individuals that are involved within the healthcare industry. And a lot of it is because individuals are attracted to other industries. They're leaving healthcare provider roles and moving on to other paying jobs or whatnot. And there's just not enough, potentially not enough training or education for individuals as this healthcare kind of revolution takes place. So again, big challenge on the healthcare provider side, where we're looking for individuals to be part of this healthcare industry and really kind of support all this growing need for healthcare in the future as well. Another big trend that we see that I think is very prevalent, especially coming from a place like Hopkins, is kind of rapid scientific progress. There's just a lot going on in terms of developments related to healthcare. So as you can see here, just new entries on a daily and annual basis of new discoveries that are happening from a healthcare standpoint. Interesting comment there for evidence-based medicine, where you've got to read 17 plus articles each day for a year just to keep up on what's going on just in the internal medicine field itself. So a lot of trends in terms of new technologies, new things that are occurring that are rapidly changing. And the challenge here is that trying to keep up with all that information, and this information kind of grows larger and larger, and it's a big challenge within healthcare, is really kind of managing data and managing all this information that's coming within healthcare. So traditionally, healthcare has been a little bit behind in terms of information technology, but now that healthcare has really embraced it, the challenge is really trying to manage and organize all this information that is there, and really then trying to take some meaning out of all that information to help patients and help healthcare providers. As I mentioned earlier, one of the biggest changes, especially for us in the U.S. and in other countries as well, is the way that healthcare is being reimbursed for healthcare providers this day and age. So up until recently, healthcare providers were actually paid or reimbursed for their services. So basically, when they do an X-ray or something like that on a patient, they were usually paid just based on how many times they did that service. So basically, their goal was to do as many X-rays or provide as many services as possible, because the more that you did, the more you got paid for, or more that you got reimbursed for. In the last 5 or so years, things have changed dramatically. Some of it because of things like the Affordable Care Act and other legislation or whatnot, but there's just been a general trend where there's a movement away from trying to do as much as you can for basically what we call a fee-for-service type of model to a fee-for-value. Basically saying that now, instead of doing as much as you can or as many different services as you can, we want to make sure that that service is done with good quality and good value for the patient. So what does that mean for healthcare providers? So for example, healthcare providers get less reimbursement or less money for a service if that patient has to come back and get readmitted to the hospital within 30 days, for example. So what we're trying to drive within the healthcare industry is trying to make sure that the healthcare providers are actually providing good healthcare, and punishing those providers with less reimbursement if they don't make good quality or good value in terms of their healthcare delivery. So as you can see, different payment reductions are made for healthcare providers if they don't provide that good quality. And a lot of the contracts, as you can see here, the general trend is happening is that they're all now focused on this kind of fee for value, or this good quality type of healthcare reimbursement. So it's a tremendous change in our industry, where again, people moving away from trying to do as much as they can to really making sure whatever they do is of great quality and great value. And this has dramatically changed the way that healthcare providers and hospitals and everybody really perform their healthcare today. Another big topic here is really trying to deal with kind of chronic diseases. So rather than kind of these one-off colds that people have, but really trying to figure out how to deal with some of these chronic diseases like cardiovascular disease, cancer, respiratory type of things, diabetes. These chronic diseases are starting to become a larger global burden within the healthcare industry here. So as you can see, it's a big trend in terms of the number of folks who are having these chronic diseases, and then also the number of people that are unfortunately killed by these different chronic diseases as well. So this puts a large burden on a healthcare system and a healthcare provider, because these become chronic patients. So these are patients that are coming back to the hospital or going back to the healthcare provider multiple times during their lives here. And we've got to figure out a way to try to deal with these particular patients and try to help them manage their way through these different chronic diseases. So again, a big trend here in terms of the types of patients that are that healthcare providers have to deal with here. Many of them, again, are suffering from these chronic diseases going forward. And all this goes back again to this cost pressure here. So we've got all these different folks that are coming in at multiple times with multiple challenges or whatnot, and we're not getting paid as much to kind of support these different folks. This is a big trend that you can see that's happening all across the globe here, where the money that's being spent to kind of provide all these different services and to help these different patients is quite a bit. And then there's not much reimbursement or basically payment for all the effort that's being done here. So as you can see, 60% of the hospitals are receiving less payment from the government, for example, than what it cost back just even a few years ago, and that's leading to a large underpayment here within the healthcare providers. So it's a big challenge from a financial standpoint for a hospital or for healthcare providers to try to provide all these different services and take care of all their different patients or whatnot, if they're just not getting reimbursed or not getting paid as much for all the costs that they're having to go through. So what does that mean for us with all these different trends here? What's really happening within the healthcare industry? So the healthcare industry itself is trying to deal with all these trends by creating a transformation here. And one of the first large transformations that's occurring is really this concept of consolidation. So the concept here is really that a single hospital by itself really says, you know, I can't deal with all these different trends and all of these different challenges on my own. I think I've really got to team up with other healthcare providers or other hospitals, and then create some sort of partnership or some sort of collaborative way going forward to try to deal with all these different trends and challenges that are occurring there. So we're seeing a lot of different individual healthcare providers or hospitals or healthcare service organizations really start to partner up or collaborate with other organizations here, and that partnership kind of varies as you look on the screen here from just a simple affiliation where one hospital says I'm affiliated to somebody else, to things like a large organization combined with multiple hospitals, or even a hospital network where hospitals are all kind of joined together and all integrated together, all the way up to hospitals buying each other, where they're saying, you know, I can't survive on my own. I've got to either be bought by a larger hospital, or being kind of consolidated into one larger organization. So this collaboration, this transformation is occurring here really because the anticipation is that it's an easier way to deal with all these different trends that are going on within healthcare. So as you can see, that consolidation is predicted to actually continue to occur quite dramatically. So just a few years ago, there were over 1,800 different institutions here that we're providing healthcare, healthcare providers. By 2024, that's going to reduce to half the size, and they're all going to be large multi-hospital health systems rather than individual hospitals themselves. So we've seen that throughout the industry here. You've probably even seen it personally with the healthcare provider or the hospital or doctor that you might see. They might now belong to a larger network of doctors or larger network of hospitals. And this continued this trend here for rapid consolidation is really going to continue here within the next 5 to 10 years. And these acquisitions are also happening quite a bit as well. So a lot of time within the healthcare industry is now spent on a lot of these different mergers and acquisitions, and it's a big dollar business here. So as you can see, just within the last 5 to 10 years, we've seen a large number of large hospital acquisitions. So a particular hospital network, a particular provider that really has expanded and says that they'll take on these challenges, and to do that, they're acquiring all the different facilities that are around them to kind of support their efforts to react to these different trends and challenges. As you can see, different analysts that are out there are saying that the consolidation is really reaching record levels here. It's big dollars that are occurring here, and it's going to continue here going forward as well, with more consolidation that's happening. So another transformation that's occurring in reaction to all these different trends, aside from consolidation, is this concept of industrialization. So really trying to do more with less, and really trying to figure out, is there a way that we can kind of standardize or industrialize the way that we deliver healthcare going forward? Again, the concept of doing more with less, as you can see, this is something that's happening all across the globe. So whether we're here in the US or in the EU, we're seeing more and more patients that are coming here in developing countries like China, for example. We're seeing a significant number of new patients that are coming into the healthcare system. But the challenge is that for the most part is that the number of beds or the number of places for all these folks to get care is decreasing, and in a place like an emerging country like China, for example, they're increasing the number of hospitals or whatnot, but they can't keep up with the number of patients that are coming in. But the general trend here is that there's just really more patients and less to deal with here. So it's really trying to figure out how do we deal with this large patient population, this growing patient population that we saw in the trends, with the less resources that we have as a healthcare provider. So some of the strategies that are being taken are actually trying to copy or replicate some of the the operational efficiencies that are gained from other industries. So, for example, looking at the manufacturing industry and how that they've really increased production and shortened wait times and lower repeat and repair rates, optimizing inventory and storage, minimizing transportation, and finding efficient uses for space requirements, taking some of those things that are done on an industrial level and really trying to translate those into healthcare by looking at how can we shorten stays, how can we shorten the time that you have to wait for a particular doctor that you need to see, lower the rates of having repeat surgeries or those repeat readmissions that we talked about, trying to figure out whether if we're ordering unnecessary exams. So if we're trying to diagnose a patient, how do we minimize the number of exams that we need to perform on that patient to kind of figure out what they need to do? Trying to, again, optimize utilization in terms of capacity, making sure that every bed is full, every X-ray device is running and taking care of patients, trying to minimize the errors that we're doing in terms of what types of drugs we're prescribing, what types of tests that we're prescribing, trying to minimize the number of places that a patient has to go to get all their different healthcare services. So can we provide all those services in one particular location? So when they come to the hospital or to come into healthcare environment? Can they get all their needs done in that one location? And then trying to figure out what is that right treatment plan for that particular patient, so we're not doing anything unnecessary. So there's really a lot of parallels that are happening here from an industrialization standpoint, really trying to figure out how do we simplify and optimize efficiently a patient's travel through the healthcare system. And a great quote here from some other folks who are really looking at the healthcare industry as well, that industrialization with healthcare is really moving away from the kind of this individual model for healthcare delivery, so and really more kind of a system-wide efficient model. So really rather than trying to prescribe an individual pathway for a particular patient, really trying to find if there's kind of a more systematic, more efficient model that would apply to more than just one individual here. So industrialization is a very, very big move that's happening within healthcare here, again, to respond to all those different trends that are occurring within our industry. The third transformation that's also happening is really managing health. So really trying to tackle how do we manage all of this going forward, and it's again an interesting response to all the different trends that are going on here. So really, what a lot of the developed countries are trying to do is, now that they've realized that they're only getting paid if they do the right types of healthcare and make sure that healthcare is of value and of good quality, what they've realized that they've really got to move towards the concept of disease management and population health management. So really trying to improve overall population health. So if we can make sure that a particular patient, rather than having to deal with them when they come to the hospital, if we can figure out a way to make sure that that population stays healthy, then they won't have to go through the healthcare system. So that's a big transformation within the developing countries. And then similarly for in the established countries. Then for the developing countries, it's really trying to figure out how to manage health. As we saw earlier, like in places like China, they're seeing a large number of patients that are now coming into the healthcare system. How do we manage that by, again, trying to manage that population going forward, and trying to reduce the need for them to go and get healthcare services. So it's really now focusing on the population. So how do we get the population healthy so they don't have to rely on all these services or have to enter into the healthcare services as often as they do. So that's why we're seeing things like big data really come into the healthcare industry. So if we can use data to help us to increase, for example, early detection and improve patient care and help us improve health outcomes, this might also help us reduce costs and also help us manage that population so they don't have to visit healthcare services that often. So that's why you're seeing a lot of big data players that are out there in industry who are traditionally not healthcare providers. So folks like IBM, like Google, like Microsoft or whatnot, really now take steps into the healthcare world because their expertise in terms of data and managing data, they figure they can lend that expertise to help us manage health going forward. So that's why you see interesting things like IBM Watson, for example, which can ingest a lot of data and then process that data and draw some outcomes from it. Try to use that to help the healthcare industry, in terms of supporting their abilities to manage health going forward. It also means that we're seeing a lot more, like we talked about consumerism, a lot more folks from the healthcare side really reaching down to the patient level to try to get data and information here. So we're seeing things like now like an electronic health record where patients can go to kind of a portal online and get information regarding their health here. There's a big push in terms of analytics, so really analyzing kind of different trends or patterns. So if we can see that every patient is always searching for a particular type of disease, maybe that's where we've got to then focus our efforts as a healthcare provider to kind of meet that interest. We're seeing things like mobile and e-health type of things that are happening here. So this is why we're seeing large trends in terms of folks that are tracking steps or whatnot and everything. If we can get the data from what different patients are doing, maybe that can help us then determine what we need to do in terms of managing health and providing the services that we need. So all those different things are happening on what we call kind of the supply side. What that means is that it means there's a lot of potential opportunity here from a business standpoint within healthcare. So new business models are really happening here within healthcare, really that are tied to kind of what the patient is doing. So really trying to figure out things that are targeted or personalized based on what the patient is doing, based on the data that we can kind of get from that patient. So can I get that information from your Fitbit and use that information to create now a personalized therapy for that particular patient or that set of patients? And again, all the concept here really trying to drive population health management. So being able to manage that larger population and help maybe do some preventative medicine so they don't have to incur healthcare services down the line. So again, all this generates a lot of data, and in this new world that we're in here, data, especially within healthcare, is becoming key. Just as a little fact here, as you can see, by the year 2020, 25,000 petabytes of data just related to healthcare here. So there's a big opportunity within healthcare in terms of data and managing that data and really trying to figure out how do I make that data actionable. So basically, what information can I get from that data, and what can I actually do with that data is something that a lot of folks in the industry, including myself, are really trying to figure out here within healthcare. So as you can see, again, more folks kind of analyzing that it's all about here the quality of healthcare that we're providing and trying to really get in front of the patient here to really try to start practicing more preventative medicine and trying to leverage things like big data and information to help us become more efficient overall here in terms of managing healthcare going forward. So again, all these different transformations are occurring, a lot of different challenges that are occurring within the healthcare industry here that you can see, in terms of wanting to try to help different patients or whatnot, but there's a lot of pressures that are being put on a hospital in terms of what they need to do beyond just kind of taking care of that particular patient. So that also means that there's a lot of different opportunities for you as an individual if you want to get into the healthcare industry and get a career within healthcare. There's, as you can see, all the different trends that we kind of talked about again, and this transformation that's occurring. There's a lot of different opportunities here. Beyond just kind of practicing medicine, if you will, to be part of this healthcare industry. So it's a really exciting time within healthcare. It's also a very challenging time, but something where I think all of us that are involved within this healthcare industry really feel like that there's a great opportunity to be very successful in here. So a lot of different trends, like I said, that you could be involved in here that could kind of that are happening within healthcare. And then again, this transformation, this consolidation, this industrialization, this ability to manage health here. A lot of different opportunities within those areas of transformation that you could build a career out of as well. So with that, that's kind of just a quick summary in terms of what's going on in terms of healthcare, some of the trends that are occurring there, the transformation of healthcare. We at Siemens, of course, are always looking for great talent and individuals as well who can help us with this transformation. As Kim mentioned, my role is really focused on our imaging and digital platform that we have going forward. So what we've realized within Siemens is that traditionally we've been a provider of a lot of imaging equipment and imaging services and laboratory services or whatnot. We've also realized that we've got to evolve now into kind of this digitalization world as well, where my team and I, we're looking at big data and trying to figure out how do we look at that data, draw some conclusions from it, help healthcare providers manage that data and create actionable items for them so that they can be more operationally efficient, so that they're getting the most bang for their buck for all the different services that they provide. So again, lots of opportunity here within the organization and also within the healthcare industry as a whole. But hopefully this kind of session gives you an idea of what's going on within healthcare today, some of the trends that are happening, some of the transformations that are occurring here, but gives you some more ideas on what potential opportunities are out there as well with healthcare. So I guess with that, Kim, I guess maybe it's time we can open it up to maybe questions or whatnot.
Sure, yeah, we have a couple minutes for questions. If you guys want to type your questions into the box, I'll read them out for Peter and he can give you guys some answers. Probably it'll take a minute to get some questions. Okay, here's one. I'm interested in getting involved in data analytics in the healthcare industry. With the changing healthcare environment, what advanced degrees, if any, do you think will be required in that field moving forward in the next few years?
Yeah, it's a great question. In terms of, I would say, in terms of advanced degrees, I think it's not necessarily a requirement, but we're seeing a couple different roles. I think if there's individuals, as we talked about this, there's individuals who are very comfortable with kind of like managing data, like and understanding how to interpret data, which I know all of us at Hopkins, we had great training in terms of doing that. That capability is very helpful. I think those of you who are have been in kind of the sciences areas or even in the engineering areas, a lot of the principles that you take away from even just getting a bachelor's degree there at Hopkins, you can apply those to kind of the data world that we are in from a healthcare standpoint. I think in terms of advanced degrees, of course, if you do have any sort of advanced degree, that's always welcome, because that is always a sign that you've spent more time really trying to understand things as well. I would also say, folks who are pursuing things like business advanced degrees are always of interest as well, because as we talked about, there's a lot of consolidation, mergers and acquisitions that are occurring from a healthcare standpoint as well. And what healthcare providers are looking for is they're really looking for individuals who could really advise them on how to deal with this new environment. So folks who can really interpret the data and then support and then tell the customer what they need to do with that information are folks that would be very valuable within this industry. So I would say, again, an advanced degree is not necessary. I think individuals, even like myself, didn't pursue an advanced degree, but we've had a very successful career in the healthcare industry. But I think it really is all about your mindset and your ability to be able to look at information and then figure out and draw conclusions on that information that's going to be very critical for supporting this industry.
Great, thanks, Peter. We have another question. Can you talk a bit about Siemens operations internationally and if there are opportunities for graduating students?
Yeah, absolutely. Yeah, with Siemens, one of the great things about Siemens, and admittedly, one thing that really attracted me is individually to Siemens is that it is an international conglomerate, and so Siemens, if you don't know, is based out of Germany. Is their headquarters. Healthcare is also based out of Germany, but we have a presence globally all across the world. So we're basically in every country that you can think of. There's a very significant presence for Siemens, a very significant presence for Siemens Healthcare as well. That also means there's great opportunities for you as an individual to pursue especially if you're interested in healthcare globally as well. So we've got centers all across the world, not only in Europe but also in Asia, even in some of the developing areas. So like kind of the Middle East area, for example, or even in Africa or Latin America and South America. The presence for Siemens Healthcare as a whole is everywhere, and there's great opportunities. And then what I would say is one of the nice things about being part of an international conglomerate like Siemens is that there's a lot of opportunities to move around the organization and get great exposure throughout the organization. So I've personally had opportunities to work internationally with Siemens, not only within Europe but even as crazy places like in the Middle East and in Asia as well. But it also means that there's good opportunities to advance and good opportunities to move around, not just within healthcare, but also you can take some of your skill sets and translate them to other industries that Siemens is involved in as well. So we have industries related to engineering and automotive, power and energy industries as well. So there's great opportunities where you can actually move within Siemens to other industries aside from healthcare and still be part of the Siemens family. So it's a large organization, but its global presence and its global footprint is something that's very attractive. And if you're interested in finding global opportunities, I would definitely encourage you to go to the Siemens website, and you'll see a large number of opportunities and openings that are available for you to jump into.
Great. I think we have one more question so far, but continue to put them in. We have a little bit more time. How do you think the industrialization will affect current jobs for healthcare professionals moving forward?
Yeah, it's a tricky question because industrialization sometimes can be taken as something negative for individual jobs and individual roles, but actually it's what we're seeing is those roles are changing a little bit. So rather than eliminating, as we talked about earlier, there's the healthcare industry really can't afford to eliminate jobs because we just don't have enough individuals within the industry to kind of address all the topics and all the different trends that are occurring. So what is changing is kind of the roles that those individuals are playing. So if, let's say from a clinical standpoint, rather than having a person that's basically administering X-rays or kind of doing imaging work, for example, that person now has to transform themselves to not only do that imaging work, but then also maybe manage kind of that imaging process. So they've got to be able to figure out how to be more efficient, maybe get involved in more of the business end of things rather than just the clinical aspect of things. So the industrialization is actually creating more opportunity within healthcare. Because things like standardization and operational efficiency, it's really changing the types of roles that are required within healthcare. So within healthcare, we really are looking for more specialists that are looking at things from an operational standpoint, that are really trying to use different things that are out there, like data, for example, to really help become more operationally efficient. So it really is more than just somebody just doing kind of one thing repeatedly, but it's really somebody now that's doing that one thing and then really applying some thought behind that one thing to try to figure out what does that mean operationally or organizationally. How does that contribute to the larger scope of the effort? So industrialization, I think, is a real positive thing for the industry. It brings some consolidation, it brings some standardization, and it brings new opportunities for individuals and jobs within healthcare to be a little more transformative and a little more in depth going forward. So it's a good thing for us, and it's something that again, we can't afford to have folks leave our industry. So we really need to continue to provide new opportunities for everyone that's part of healthcare.
Great, thanks, Peter. The next question is, as you reflect on your career thus far, what things did you do or participate in while at Hopkins that have been most helpful in navigating the healthcare space at Siemens?
Yeah, it's a good question. It's been a while since I've thought about my days at Hopkins, but I think what I could advise is that, and I was hoping with this presentation was really to just help you realize that there's a lot that's going on in healthcare. And I think when you're at Hopkins, there's a lot of focus on friends and colleagues who are doing like research, and things are real cutting edge there, and a lot of innovation that's going on within Hopkins. And when you think about healthcare and medicine and everything, it's all about kind of these new discoveries and new innovations that are happening, which are great, which are fantastic, which, as we talked about in the trends, something that's occurring at a real rapid pace. What I think you could do is really try to also understand that from a healthcare standpoint, there's really this evolution beyond just innovation. It's kind of like the business end is really now coming into healthcare. And I think if you can get more exposure in terms of how healthcare organizations are really dealing with kind of all these other changes besides innovation, that would be really helpful for you. So really try to get in tune with what's going on with healthcare beyond what the next new discovery is. That's really what is on the mind of everyone within healthcare. So it's again, the new discoveries, the new innovations are great, real important. People want those to continue to happen. They want They want institutions and leaders like Hopkins to be discovering those things. But the flip side too is that there's also just now a big change within healthcare in terms of how do we deal with healthcare with this larger population. How do we deal with not being paid for or reimbursed for all the services that we're doing with? So there's really kind of just this business aspect of healthcare that if I were in your shoes, I would just try to figure out ways to get more exposed to that. And really, maybe it's just trying to understand operationally how does a hospital work or whatnot. But attending things like this webinar and just other opportunities to get a different view of what's going on within healthcare beyond just innovation would be a great start, because that's really what this industry and what we're looking for right now. So again, we're always going to need the innovators, the folks that are discovering things. Those are great, but where we're really hurting and where healthcare really has a need is really how do we kind of manage healthcare going forward, and individuals that can come out of the academic world who have this type of experience, or at least some knowledge of it, will make you more attractive, in terms of getting a position or starting a career within this industry. So having kind of just this understanding, I think, is a great first step here. So seeking opportunities to kind of understand what's going on. Get a better understanding in terms of when they talk about the Affordable Care Act and things going on in the news, and politicians that want to change some of that, trying to understand what does that really mean, because those are the topics that are really on the minds of folks within healthcare today. So really, again, just trying to get that exposure to things beyond innovation is a great first step.
The next question is, what is the biggest obstacle you think facing this challenging healthcare, i.e. regulation, budget, implementation?
Yeah, those are, I mean, all three of those are huge challenges. I think, you know, um, I don't know if there's really one that's the biggest, but I would say that I would say implementation is one of the biggest challenges for the industry. So I think what we're seeing within healthcare providers and even within industry as a whole, like as Siemens and Siemens Healthcare as a whole, is us really adjusting to this change that needs to occur. So for providers, it's really trying to move their organization away from this fee for service model and really towards this fee for value model. So it's a really big mindset change for them, because traditionally you would think you just want to do and provide as many healthcare services as you can to as many people as you can. But now it's really changed to really look at, you know, making sure that that service that we provide is of best quality. So healthcare organizations are spending a lot of time and resources really trying to make sure that the patient experience, for example, when a patient goes to their hospital or healthcare system, is of the best experience possible. So, you know, just anecdotally, I was just at a conference the other day where healthcare system, they actually hired a individual that came from the Ritz-Carlton hotel industry to come over to their healthcare system to be basically their chief experience officer, because they wanted to make sure that their patients had the best experience possible when they were going through their hospitals. And so this is where, you know, this is where the challenge is that as healthcare providers, as hospitals and whatnot, they're really trying to transform into making sure that there's great quality with the healthcare that they're delivering. For us on the industry side, it's also a big change as well, implementing this change as well. So similarly, from a business standpoint, you know, we traditionally where we made a lot of money and profit and everything was really just selling technology, in particular Siemens. You know, we sold technology to a lot of healthcare providers like CT scanners, MRI scanners or whatnot, and we sold them in large quantity. We're changing as well, because we're realizing that it's more than just kind of selling them a box. We really actually need to provide beneficial services behind that box that actually also support kind of this change in healthcare. So we're looking at ways, doing things like creating digital platforms and whatnot, where now our healthcare providers, our customers, can basically say, okay, we're going to get some equipment from Siemens, but that equipment's going to help us save time or be more efficient or reduce you know, exposures for patients or whatnot, whatever the case may be. But basically to provide more value beyond just the transaction itself. So it's a big change for us as an organization. It's a big change for the healthcare industry as a whole. Again, this implementing these changes on a system that traditionally had always worked based on the number of patients that they saw. Is I would say, you know, is definitely one of the larger challenges that we have as a whole.
Great. And then we just had a student asking if this will be archived and emailed out to us. It'll actually be posted on the JHU Career Center YouTube page. So if you didn't get a chance to see the whole thing, or you'd like to go back and reference the webinar from today, please check out the JHU Career Center YouTube page. Any final questions for Mr. Shen? All right, thank you so much, Peter. I think that we're all set for today. Do you have any closing thoughts?
No, I think again, appreciate the time that everyone spent this morning. Hopefully you got some insight in terms of what's going on in the healthcare world, and hopefully you see some potential opportunities where you can be part of this healthcare industry as well. A lot of changes, but the changes are real positive and real exciting here. A lot of great opportunities as well. So if you do have any other questions or would love to talk more about kind of what's going on or whatnot, my email address there is on the screen, and so feel free to reach out to me. Would love to chat a little bit more with you individually in terms of what's going on. But again, best of luck to all of you, and again, appreciate the time this morning.
Thanks, everyone.